Okay, thoughts on type 1 diabetes, possible cause, therapies, two personal stories. Both had intense symptoms of vomiting, flu-like symptoms, followed by excessive thirst, urination, and high blood sugar. So there's two types of diabetes. Again, now we're talking conventional medical theory, which again is probably not correct, but let's start with that. So there's type 1, which is considered an autoimmune disease, even though I have good information from Hillman that the whole concept of autoimmune disease is flawed. But let's forget about that for a minute and say there is some autoimmune disease which is basically destroying your pancreas. Particularly, I think it's the beta cells that make the insulin in the pancreas. I could be wrong about that. There's two types of cells in the pancreas, one that makes pancreatic enzyme, one type, and the other that makes insulin. I'd have to check on which one is which, but I think it's the beta cells make the insulin. I could be wrong about that. So that's type 1 diabetes. You stop making insulin, and the function of insulin, we're told, is to circulate in the blood and bind to insulin receptors embedded in the cell membrane, which then allows the cell to take up the blood sugar, and the blood sugar can then go into the cell and be used by the mitochondria to make energy. Type 2 diabetes is totally different. In that case, there's some essentially blockage or blockage of the effectiveness of insulin on the cell membrane. And so the insulin doesn't work. And so the body makes more insulin to try to compensate for the fact that the insulin is not being effective in getting the sugar into the cell. So then you end up with too much insulin. And since insulin tells your body to store fat, type 2 diabetics who have too much insulin are typically fat and have a high blood sugar and all the consequences from that. So this question is on what causes the first type. And the whole key of that is what caused your body to essentially attack your pancreatic cells that make insulin. So let's go back a little bit. Is that even true? So we know that there are antibodies made because you can test for those. We also know, as you've all heard, antibodies are far from specific. So what that really means is you have some toxic protein, either exogenously that you're exposed to exogenously from the outside, or maybe endogenously inside you is being produced, and your body's saying, we don't want that protein, and so we're going to make more antibodies to try to neutralize that protein. Now, one could imagine that if you keep being exposed to that protein, that it may overwhelm your ability of your antibody production system to neutralize it. And then for whatever reason, and I don't know the answer to this, that toxic protein has an affinity for those cells of the pancreas, and it actually destroys them, and then you can't make insulin, and then the insulin can't function to get the sugar into the cell. The other part of that theory, which I would question, which we've also been over, is because there are no receptors embedded in the cell membrane, right? We've already been through that. The insulin can't possibly work by binding to receptors imaginary receptors in the cell membrane. That doesn't mean that insulin doesn't help the tissues and cells get sugar. They do. They probably do that by binding to a protein that's in the cytoplasmic gel. And I would say that that's maybe a semantic point. But just to clarify, it isn't like I've now decided that there are insulin receptors embedded in your cell membrane. As far as I know, that's not true. But the insulin can bind with the cytoplasmic gel and have an effect, and that could facilitate the uptake of sugar. And that's not happening because in type 1 diabetes, your ability to make insulin has been compromised because the cells of the pancreas which make it have been poisoned and therefore not able to make this insulin. So if you think like that, it's not about getting rid of the antibodies. The antibodies are trying to neutralize the toxins. It's simply a matter of stop poisoning yourself. Now, I would also say that, an acute bout of type 1 diabetes, as this person described, can be fatal. So this may be something that you have to treat with intravenous insulin, that you have to work out in your own situation with your own providers. So I'm not saying that that's never needs to be the case, but I think there is some clues as to what the toxins might be, and it's probably our old friends, the childhood vaccines, loaded with things like aluminum and other kind of toxins, which actually poison the pancreatic cells that make insulin, and that's why there has been a dramatic increase in the incidence of type 1 diabetes in children and other people in the vaccine era. And that also, there may be other factors. I'm sure glyphosate is part of it. I'm sure electromagnetic fields, but it's those kind of things which are probably poisoning your pancreatic cells. You make antibodies to try to neutralize it. There's no autoimmune disease needed or anywhere close to this. It's simply good old-fashioned poisoning, and so that's what you have to deal with.